Hi, my name is Dr. Mark Cohen. I'm a practicing ophthalmologist and I perform eye surgeries in both Ontario and in Quebec. I'm also a co-founder of Access. I'm here today to talk about closing the gap for patients in Ontario, thousands of whom spend far too much money paying out of pocket for surgical care that should be covered by OHIP. Cataract surgeries are 5 to 10 minute procedures. The procedure includes anesthesia delivered through eye drops. Patients typically arrive and are operated in their street clothes and can leave the operating room and facility simply by walking on their own accord following the procedure. About 1 in 6 cataract patients in Ontario are paying for out-of-pocket care. Let me break that down. About 180,000 cataract surgeries are performed in Ontario each year. Of those, about 150,000 are funded by OHIP. That means approximately 30,000 patients are opting to pay, often seniors on fixed incomes, to avoid wait lists. They're not doing so to skip the line, but because the price of waiting is too high. Delaying cataract surgery can have mental health and cognitive consequences. It also increases the risk of physical injuries, such as falls. Because tens of thousands of patients in Ontario are paying for their own surgeries, wait times often appear lower than they actually are. The Ontario government has made it clear it wants to reduce wait times and increase access to OHIP-funded surgeries in community surgical facilities for other procedures, such as knee and hip replacements. But it has left eye surgeries off the list. This choice puts Ontario behind other provinces. In most provinces, most publicly funded eye surgeries are performed in a physician-owned community surgical facility. Ontario is one of just 3 provinces to have yet to fully expand this model. Ultimately, this means Ontario is falling behind. In the coming months, you'll see me and other frontline practitioners who care about access to surgical eye care coming forward to move the government towards these policies. We will be sharing these pragmatic and tested solutions through in-person advocacy and online communications across the province and the country in the coming months. Now, I know you've heard a lot about cataract surgeries from other health care groups lately, and let me be clear. We do not want 30,000 people each year forced to pay out of pocket for timely care. Medically necessary cataract surgery should continue to be fully covered by OHIP, regardless of where it takes place. A community surgical facility is no different from a doctor's office. It is a regulated, accredited, clinical environment that must follow the same billing rules and oversight structures as hospitals. Physician communication and oversight must be the same regardless where a surgery is performed, whether they're community-based or hospital-based. Patients deserve the same protections and quality of care no matter where they receive it. If we expand access to care in community surgical facilities, we can reduce both the cost to OHIP and the number of patients paying out of pocket. We can also reduce the burden of our crowded hospital system. Today, we can free up 7,000 operating room days annually by moving more cataract surgeries to the existing 40 community surgical facilities in Ontario. We can provide safe, high-quality care without the same risk of a hospital-borne infection. To the government members watching, I want to say I agree with you. We need to get low-risk surgeries out of hospitals and into community surgical facilities. But we also need Ontario to follow the lead of much of the country and add cataract surgery to that list. It isn't novel. In most of Canada, it's already the norm. Today is just the beginning of what you'll be hearing in the coming months from Access.